I'm 46 years old, and I started noticing that my left eye seemed to be changing much faster than my right eye. And being in my 40s, I'm presbyopic, so I started losing my near focusing and everything, so I expected that to happen. But then I was like, you know, this eye is really changing much more rapidly. So it took me a few months to convince my husband that I wasn't seeing really good in this eye, and he finally took me in to the office at like 7:30 one night after I was complaining of blur, and he couldn't believe how thick of a cataract I had in my left eye. So, you know, insert Dr. Paul Pedalin to come to the rescue and clean up my vision for me.
So how did we end up here?
I know, so soon.
So tell me the story a little bit. Jason kind of told me the story, but you just were feeling like...
Yeah, I just thought my left eye wasn't keeping up, and you know, we kind of talked about, I clearly am right eye dominant, and so I just kept using my right eye, and I was doing okay. And then one day I was driving to work, and I was just kind of testing, and I'm like, wow, my left eye's really gotten blurry. Yeah. So.
And that's when Jason sent me the photograph.
Yeah. Yeah.
The sabotage photograph.
Yeah.
What do you think of this? But didn't tell me it was you.
Yeah.
So,
yeah.
Do you feel like anything's going on in your right eye?
I don't notice anything in my right eye. My right eye seems really good. You know, a little presbyopia, but otherwise seems great in the distance.
Okay, let's take a look real quick. Do cataracts at a young age run in your family?
Not at all.
Okay.
No.
Go ahead and rest your chin. Let's just take a peek. So this is the type we'll see, like usually in a young patient. There's a PSC, it's called, as you know. But sunshine areas, we see it a lot, and you don't have to have taken steroids or anything like that to get it, but that's what you've got, and this left eye is definitely ready to go.
Yeah.
So you're good. So that kind of brings up the conversation about what to do, right? I mean, once it's clear you have cataract and that's ready to come out, certainly in the left eye. I think your right eye's probably got a little ways to go, but it wouldn't surprise me if you don't get too far down the road before your right eye bothers you, especially because your right eye is your dominant eye.
Yeah.
You know, so you'll have this comparison now between the left eye and the right eye that makes it more likely that the right eye bothers you a little bit.
Okay.
Especially when you're doing all the stuff that you like to do, like playing golf.
Yeah.
Yeah. But what's helpful, we talked about a minute ago, is that we kind of know, which we don't always know in every patient, that you tolerate your left eye having some blur, you know, in the distance, and still can feel good about your distance vision. That's helpful because that makes it so that we have lots of choices with the left eye in terms of trying to, obviously at a young age, at 46, trying to find a way to have you walk away from your cataract surgery with the least amount of dependence on glasses as possible. It'd be great if there was always like one play that worked perfectly for everybody, and that was the one that we always used every time. But I think you're in a position where there's lots of good options for that left eye. Probably the two smartest ones would be to either leave that eye a little bit near powered, which would mean that the distance vision wasn't as perfect as it could be, as you know, and that there was some near vision coming from that. Or we could put a lens like a multifocal in, which is designed to try to give you everything, and I think that one's kind of tempting.
Yeah, and it sounds nice with us liking to golf and liking to watch golf.
Right.
It's appealing to have good distance vision.
One of the downsides of the multifocals is that they're not known for giving necessarily the most perfect distance vision quality, right? So we tend to be a little bit picky with what situations we might use them in if distance is really at our absolute premium, which it very well may be in your right eye, right? So that may not necessarily be our first choice for the right eye. But in your left eye, which is your non-dominant eye, I wouldn't be too worried that that's going to interfere in any way, right? So I think that lens makes a lot of sense for your left eye.
Yeah, sounds good.
Do you have any questions about surgery? I mean, you know from
I mean, yeah, I guess I just
15 years of experience to this.
Yeah.
Patients do great with it, but
yeah, and I have been seeing some patients one day post-op, and they look like they're doing very good. What will be the comfort of my eye day one? Like, it will just be a little scratchy, like just kind of expect, you know.
So we're gonna video it, which you're okay with, so I appreciate that.
Yeah.
So I'll be able to chat with you kind of while we're in there. In the surgery itself, you know, they'll give you a little bit of fentanyl and Versed in pre-op, which they won't push that until you get close to being back into the room where your surgery will take place. And that'll just make you feel chatty. like, you know, like you've had a drink or something. You won't fall asleep though. We don't really want patients to fall asleep because we don't want them to wake up, you know, while we're doing it. It's not going to take very long to do the procedure. Probably the most intense thing that you're going to notice during the surgery is the light's going to feel like it's intense, especially in a younger patient like you. We can turn that down, the light from the microscope, but you almost kind of need to be looking into the sun, it feels like. But it'll be over quick. And then if you're going to feel something the day of, usually the 2 little incisions that we make to take your cataract out, they create a little area where the epithelium is missing and the skin is missing and the eye is going to feel a little bit teary and light sensitive. The prep, we do a betadine prep and some things prior to surgery. That'll make the eye feel a little irritated. So if you're going to feel something on the day of surgery, it's just this general feeling that the eye's not thrilled, that it's a little irritated, scratchy. Drop-wise, we're going to be able to put the antibiotic in your eye. We'll put a little bit of a non-steroidal in the eye. So the only thing that you'll be taking for the first week or 10 days after surgery is just a steroid.
Okay.
I can't think of anything else, can you?
Yeah, I mean, I'll go back to seeing patients, I'm assuming a few days after, and that'll be
You
good.
could go back the next day.
Yeah, okay.
So you wear a shield that first night, but your vision should be quite good. You know, you have blue eyes, so your eyes will stay dilated. The fluid has phenylephrine in it, so it'll make your pupil dilate a little bit larger than like drops from the clinic would make your eyes dilate. So it wouldn't be surprising with blue eyes that your pupil stays dilated through the second day.
Okay.
But you should be good. You should do great.
Okay.
So we'll see each other tomorrow?
Yep.
Okay.
Excited.
It's kind of funny, the last few days I've been thinking about like everything I say to patients about, oh, the surgery's great, it's safe, you know, everything's good. And I'm putting that all through my head like, okay, you know, I know that this is true, but like now it's my eye. But I feel really good about it. I mean, I think any surgery, you kind of go in, you know, you're gonna have a little bit of nerves, but I really feel really good about it. I don't feel like I'm getting sick over it or overly nervous about it. I'm actually pretty excited to have some excellent vision with this left eye. I think it's really important to have confidence in your surgeon and them picking a good implant for you based on, you know, what you're telling them, what your daily life is like, what your expectations are afterwards, and really confiding in your surgeon to make that good decision for you. What I love about Dr. Paul Pedlin is he really does care about what is going to be the best case scenario for the patient. I think if you do any research on Dr. Paul Pedlin, you'll see that he is one of the best surgeons in the Valley.
You know, you're just gonna be like a normal patient.
Hi.
Hi, how are you?
Good. Tara Ransdell.
Do you have your insurance cards?
I do.
I feel pretty good today. Little, you know, normal going into surgery nerves, but actually pretty excited about the whole procedure. Yeah, I kind of look forward to the next week and see how my vision is.
All right. We're live.
Yeah.
What do they got this in here for?
I don't know.
They don't want you to cry. So it'll be really simple. The light will be bright. You'll feel my hand on your forehead too, a little bit of pressure. We'll do the aura. When we do the aura, I'll turn the light from the microscope off for you, which will give you kind of a break. And you'll see a really distinct kind of flashing red light in the center of the system. So if you can kind of look at that, and then we'll capture, it only takes about 2 seconds to capture the aura.
Okay.
And then it'll confirm the power, and then we'll be good.
Okay.
Shouldn't be anything to it.
All right.
All right.
All right.
All right.
Right, let's go.
All right. So here we go. I like that much better.
And Moxie, you're ready.
We're good. All right, Tara, this looks beautiful. We're all finished.
that was perfect.
So I had cataract surgery yesterday at the age of 46, which is a little unusual. It's about 20 to 25 years earlier than average. And everything went fantastic. I'm very happy with the results already. And I know it's only going to get better in the next 2 weeks, really. Today I got up early, took the dog for a walk, did like 2 hours of computer work, and I kind of have to tell myself that I have restrictions today still. But I feel fantastic. My vision's really good in the distance, and I already have more near vision than I had prior to surgery. Really honestly expected my eye to feel more scratchy, a little bit more irritated from a surgery, and really had nothing. I mean, a little pressure around the eye, no scratchiness, no pain. I mean, I'm actually really excited to have better vision, post-surgery.